What's going on, ladies and gentlemen? It's your boy Nurse Bass back with another video, and what I wanted to talk to you guys about today in this video is my transition from ICU nurse to OR nurse.
Are you listening? Nurse Bass. Beast mode. Grinding.
So I've been MIA from YouTube for a minute. Surprise, surprise. I have had a lot going on, a lot behind the scenes, most of which I can't even tell you about. But I am going to enlighten you as to where I've been professionally. I got to take you back a little bit though. For those of you who have been following me for a little while now, you'll know that over the past 2 years I've lost my mom and I've lost my dad both. And I've had a new baby boy, who's doing great, by the way. So needless to say, I've had a lot of life changes, a lot, in a very short amount of time. Whenever I was in the ICU, I really enjoyed it. I loved working in the ICU. I loved the hemodynamic management of these critically ill patients, intervening appropriately when needed in order to produce good outcomes. It was awesome. I loved all of that. But also, along with working in the ICU, you know, on one hand, I was working nights. That played a little bit into it, but then secondly, you do see some bad outcomes. You do see death. And it was kind of a culmination of those two things, having to leave my family and my new son at night to go into this environment where you do see a lot of death, after having already dealt with a lot of death in my own personal life. It kind of culminated into one big ball of depression. It really started affecting my mental health in a very bad way, began to deteriorate. And so my wife and I had a lot of conversations, and we kind of come to the realization that we should move back home. Now, keep in mind, where we were living, we had no family, had nobody, no friends, no family. All we had were each other, our son, and our co-workers. So that's another component. So we kind of made the decision that we wanted to move back home. So we did. We moved back home, and things have been going great here. But with that move came the obstacle that I had to come across with deciding what I wanted to do. I kind of made the decision that although I love the ICU so much, it just wouldn't be realistic for me to step back into that kind of environment so soon. So I initially began playing around with the idea of PACU, maybe still staying in that critical care realm, taking care of these post-op patients and hemodynamically managing them. But then again, my heart was also still being drawn to the OR, because whenever I was in my critical care residency program, as part of working in the cardiovascular ICU, we had to shadow a couple of open heart cases in the OR. And it blew my mind, that experience whenever I was in there, being able to see them actually open up this patient's thoracic cavity and access the heart, and seeing all these anatomical structures that I had only previously been able to learn about and see diagrams of in a book. That was mind-blowing. And then on top of that, also seeing all of these individual healthcare workers in their designated roles working in unison and in conjunction with one another for the best of this patient. That was awesome also. It looked like a really well-oiled machine, and it was just like, I like this. Plus, you know, I always had the hope and the dream of becoming a CRNA, and you know, it would be another step to get my foot into the door of the OR. Now also, I knew going into the OR that if I decided not to go back into the ICU, that I would pretty much be sacrificing my opportunities, at least for right now, of becoming a CRNA. And that was a really tough thing to swallow, because that was kind of my future career. That was the end goal. And, you know, and like I said, plus I still love the ICU so much. So I was really torn. It was a very tough decision. But like I said, my mental health and the future of my family really is what mattered most. So that was the choice that I made. So that was the decision and the things that went into my transition over into the OR. But now that I'm here, how have things been going? Well, I'm now in a perioperative residency program. There's about 30-ish of us, and things have been going well. So this is kind of like, it's roughly a 6 to 9 month residency program. I know that sounds extremely long. I don't know if it's going to quite go 9. I think those final 3 are whenever you actually get into your specialties, and then you kind of determine how much time you need. But essentially, it's a 6-month program. These first 2 months have consisted of 2 days of didactic in the classroom time, learning about what it means to be a circulating nurse, and also about the operating room environment in general. And then the other 3 days have been actual at the clinical sites in the operating rooms, operating as a circulating nurse with a preceptor. Things have been going great. It's a massive learning curve. It's a massive learning curve. There's so many things that you have to know and so many small, detailed nuances that you really have to keep up with. But I'm loving it. Things are going well. I would say that I'm thriving for the most part. Just doing what I normally do whenever I'm new and I'm approaching new topics and concepts. I'm just getting in there, immersing myself, being a sponge, absorbing all that I can and learning all that I can. If you guys want to see additional videos or more detailed videos concerning the operating room and what that may entail, just let me know down in the comments below. But aside from that, what does the future hold for Nurse Bass? So, especially now that CRNA may very well be off of the table, I'm thinking what I'm leaning towards. I'm now in the process of about to go back to school to get my bachelor's. For most of you who've been following me, you'll know that I only have my associates. But the time has come for me to go back to school and get my bachelor's because like I said, my wife and I are trying to plant our roots here and get truly established and build a life for our son and our little family. So I feel like it's time for me to go back and get my bachelor's, and that the transition, at least for right now, things can change, but at least for right now, the transition is going to be to acute care nurse practitioner when that time comes. I think I want to go to NP school. I'm still kind of torn as to whether I want to do surgical nurse practitioner or if I want to do critical care nurse practitioner. Like I said, my heart is kind of with critical care. It always has been. And this would be about 3 or 4 years down the road by the time I would even complete this program anyway. So maybe, hopefully, goodness, I'll be in a better headspace to be able to operate in that environment. And if I feel like I am, then I think that I would lean more towards being a critical care NP. What I really always enjoyed the most about being an ICU nurse, like I said, was that hemodynamic management. Was using my brain in order to try and figure out what's going on with this patient physiologically, and how can I intervene appropriately in order to remedy whatever the situation is. And I feel like if I were to operate in the ACNP realm, that would be what I would be doing. I would be putting my assessment skills to the test, truly be trying to determine a diagnosis for this patient and then a path to move forward for this patient to try and help get them well and have them walking out the front door of that hospital. That's where my head is at right now. Like I said, that is subject to change, but that's kind of what I'm thinking. But if I do end up completely falling in love with the operating room, which I hope that I do, then a surgical nurse practitioner may be a route that I may end up going as well. So there's still a lot up in the air, a lot to be determined, and a lot of education I still have to get under my belt. But the future is bright, man. The future is bright. I'm excited. I'm thankful for the opportunity. Everything's just going good, man. I'm happy. I'm blessed is what I can say. I appreciate all you guys for still sticking around, man. I know, like I said, I haven't been on YouTube in a minute. Really been slacking all last year, honestly. I know I've been going through a lot, but I always preach the grind, and I always preach, that life is just gonna throw stuff at you, man, and it's relentless. It will beat you down, and it is truly all about how we respond to that. How do we react to that? And it's a lot easier said than done, but that's kind of where I've been at, man. I'm sorry I've been MIA. My plan is to get back to these videos. Got a dope new camera, as you can see. Got a lot of things in works that have been going on that have contributed to my absence. And you'll be seeing all of this come to fruition very soon. Anyways, it's your boy Nurse Bass. I hope you guys enjoyed the video. If you're new to the channel, be sure to hit that subscribe button down below. And I look forward to seeing you in the next video. Peace.